Audit and donor compliance. Donors and financiers are demanding radical transparency, and AI makes the impossible audit possible. So we are used to our traditional paper audit where you have to put all your paper together in a file and bind them and take it to an auditor to have a look at it. But with AI, we now have an easier way of complying to audit requirements, because when you look at most of your donors, they already have a set of requirements that you need to fulfill, a set of procedures or requirements that you need to fulfill. And you always know that you need to be audit ready. So one of the things that we could use AI to, and I'm encouraging us to start using, is that AI will be able to give you real-time accountability so that you're able to move, you're able to report, your processes are auditable on the go. We have also noticed that most donors are now moving towards regular audits. And this is just to be able to manage their risk better instead of piling risks for the end of the year. Then they are able to identify risks maybe in a quarter, every quarter, or every 6 months, and then you're able to modify and change. So AI is able to help us with real-time accountability. And again, what I said in terms of COCO, there's the traceability uh, for COCO, and also there's traceability for the last mile in terms of health. We are able to trace medicines right from the client. When a patient complains that the medicine has problems or they had a negative reaction, we should be able to trace this particular tablet right from the clinic where it was issued to the warehouse where it landed before it went to the clinic. From the port that it passed, we need to know how many hours it spent. For example, for us in the Caribbean, our medicines normally pass through Miami, or they must pass through Panama. So we are able to know that in Miami, what was the temperature in Miami? Could it have been affected there? Then if we find that it's not at the hub, then we trace it back to the airplane that carried it. We can trace it back to the warehouse, to the manufacturer. The manufacturer can then trace it to where they got their ingredients. So AI is able to help us in traceability. So anomaly detection, AI flags suspicious in terms of so AI are able to flag out double billing or inventory leakage real time rather than later. Because then when you have an AI, it means it's working, it's a bot that you have customized to be able to work all around 24 hours a day. So as you move your inventory, as you prepare your documentations and move your inventory, it's able to report to you, and you're able to rectify some of those mistakes as you go along. We also have natural language processing scans, which scans thousands of donor grant and agreements to ensure procurement matches specific regulations. So when you're dealing especially with public procurement and when you're dealing with multiple donors, then it means that you may have one grant, you may have one project that's being funded by different donors who have different regulations. For example, the EU, the US government, probably UK government, FCDO, all their rules they almost are similar, but there's always one or two areas that are unique to their countries and to their regulations, because they're all governed by their constitution. So with AI, you're able to put all these documents, all these donor fund regulations and grant agreements into one portal, and then you're able to match the specific, and you're able also to highlight what is it that's different, what is it that the US government wants that the UK government does not want, and then you're able to comply with that. So for vaccine distribution, so I'm just going to go through an example for vaccine network, and this is mostly done by UNICEF, and I know that the UN bodies are also very good, very, very high in using innovation and AI. So one of the things that we are doing is in terms of vaccine distribution, there are AI-powered cold chain monitoring systems and softwares that have been developed that are able to monitor vaccines right from production up to the last mile. Sorry. This has created safety along the vaccine chain, but also safety to the patients, because this has reduced manual compliance and documentation and by thousands of hours annually, and significantly lower temperature excursions. When you look at the cold chains, there is always a temperature machine or a thermometer that is attached to each and every shipment. This thermometer reports in real time. So it will tell you whether there's a spike in the temperature, whether there's a fall in the temperature, and if there's anything that would have happened that require intervention, so that by the time the vaccine reaches the patient, it is at the right, it has the right it's of the right temperature and it's of the right mixture. So what most of the vaccine logistics industry has done is that they have fully incorporated AI. So right now, there are no vaccines that are being shipped that are not traceable, which is a good thing. However, as procurement persons, then we need to get involved in this system, because what I see is that we leave this to the warehouse. As a buyer, I would assume that that's the domain of the warehouse person, or it is the domain of the pharmacy. As procurement persons, we need to be able to feed into this process and into this program, because then it also feeds into our forecasting, it feeds into our lead times, and it feeds into the advisory that we are giving the users or the requesters within our organizations.